ask you, are there patients in your region, that great big region where you work, who have trouble getting access to radiation therapy?
Certainly. Central Queensland is a very large area to cover for a radiation service. We cover around 117,000 square kilometres, which is about half the size of the UK. This area is serviced by 2 machines, and the challenges are in and around travel and the distances required to access radiotherapy treatment.
And other than the travel, the distance, are there 1 or 2 other barriers you find when it comes to making sure everybody gets access who needs it?
Often people who've been diagnosed with cancer are generally almost frail and vulnerable people. So a lot of the times the issues are not just medical, but the socioeconomic costs of travelling 400 or 500 kilometres to access your radiotherapy. So certainly having a service within the region is a very positive thing, but still within the region itself, still very large distances need to be travelled. Being away from home, being away from loved ones, generally when you're most vulnerable.
Look, you've just become the co-chair of the Targeting Cancer campaign with the college, with Lucinda Morris. Just in a nutshell, why have you taken on extra work? You're a busy man with a lot of travelling to do.
Look, radiotherapy is such a vital part of cancer care services. When we look at the access of radiotherapy in Queensland, at the moment, only around 60% of people who require radiotherapy for their diagnosis of cancer are actually getting consultation and getting the service. What I'd like to do with Targeting Cancer, as well as closing the care gap, is to make radiotherapy more well-known through our community, both in the primary care setting, but also to our potential patients, not just within the central areas where services are provided, but also in our smaller communities where radiotherapy is accessible, however, at a bit of more of a cost to the patient with regards to time away from home and time away from family.
Tuan, thank you so much. Thank you.
No, it's been a pleasure, Julie. Thank you.
Wherever we live, we deserve the best possible chance to survive cancer and receive the treatment that will benefit us.
Our families should be able to get access to radiation therapy if they need it.
Right now, there are Aboriginal and Torres Strait Islander cancer patients who are struggling to get the radiation therapy that they need.
In some parts of the world, it's impossible for cancer patients to get radiation therapy.
The Targeting Cancer campaign is supporting the work to close the care gap in radiation therapy at home and abroad.
To learn more and to find out how to help, please visit the Targeting Cancer website.